For those people who have corneal astigmatism, which means a curve on the cornea, so you can see on the map on the left-hand side, this red line means that the cornea is very steep in the 90-degree axis and very flat in approximately the 0 axis. So the curvature that's mapped initially at the consultation is then put into a program, and we put the astigmatism figures into this algorithm, which then allows us to calculate a special lens, and the lens has to be implanted at a certain angle inside the eye. So for those people with astigmatism, the surgery is pretty much the same, with one minor difference in that just before the surgery happens, after the anesthetic drops have been applied, we put a little mark on the very surface of the eye with an instrument to mark the axis of the astigmatism, so that when you're lying down, we can orientate the special lens with your astigmatism. Now, the special lens looks like this. So it looks pretty much the same as a monofocal lens, but you can see up in the top left and the bottom right here, there are these additional marks on the lens, which indicate that it's a toric lens for correcting astigmatism. So these marks will need to be orientated with the ink marks that are placed on the surface of the eye. This is what they look like in close-up. So it just takes a few extra minutes during the surgery to do that. But for people with corneal astigmatism, it will give them a much better outcome and less dependent on spectacles. The compromise with this is there's just a small chance, about 2%, that these lenses can move in the early post-operative period, in which case that will necessitate a second procedure just to reorientate the lens back into position afterwards.